All right, Cindy, what would you like to talk about today?
Well, my periods have been pretty irregular. I've been bleeding for about 7 to 10 days and pretty heavy, and I just didn't know if that was normal.
How long have they been lasting 7 to 10 days?
About 6 months.
Okay. And prior to that, what were they like?
Regular. I've always been regular, only about 4 to 5 days, and not near as heavy as they are now.
Okay. Can you think of anything that happened 6 months ago that might contribute to that?
No.
Okay. Have you been examined by your family doctor?
Yes.
And everything's okay as far
Yes.
as they're concerned? Okay.
Yes.
All your blood work and everything's come back normal?
Yes.
All right, super. Well, realistically, your periods are a little bit longer than considered the normal cycle. Most cycles are 4 to 6 days.
Right.
It is common to have a little bit of clotting and a little bit of cramping, but not so much so that it affects your lifestyle.
Right.
If it affects your lifestyle, then we need to evaluate some things.
Okay.
And if everything's normal, you don't have any abnormalities that we can see, you might be a candidate for her option. It's a cryoendometrial ablation. Have you heard of that?
No, I haven't.
Okay. Her option is a process by which we freeze the endometrial lining. And in doing so, about 93% of women will say their periods are better. Less bleeding, less cramping, less number of days. About 20 to 25% possibly could stop having their periods altogether.
Oh, wow.
Now, I wish I could guarantee everybody that.
Mm-hmm.
I can't. My goal is to get you as close to a normal period or lighter period as possible.
Okay.
It's a procedure that we do in the office. You're fully awake while we do it. Now, I do give you some medication to help you relax. Most
Okay.
of my patients say they feel like they've got about a 1 to 2 margarita buzz.
Okay.
So you'll have to have somebody to drive you to the procedure and drive you home.
All right.
That particular day, you take it easy around the house.
Mm-hmm.
Not necessarily staying in bed. Really, the only thing you shouldn't do is no driving, no adult beverages.
Okay.
I usually do them on a Friday morning, so Friday, take it easy. And then Saturday, the old joke is you can drink and drive, just don't do them at the same time.
Okay.
The activity level the next day is perfectly fine for whatever you want to do. You go about your own normal business after that. You can expect a little bit of spotting, a little bit of cramping that first weekend, and then have some discharge for about 3 to weeks after that.
Okay.
Now, the cycles, they may automatically change. You may not have any cycle at first, or you may still continue to have very heavy periods for the first couple of months. It usually takes between 4 and 6 months before we determine if it's been a success or not.
How long does the procedure take?
It's usually about a 30-minute procedure.
Okay.
Now, we give you, you come into the office about an hour before the procedure. We give you your medications. You stay there with whoever drove you, and you're nice and relaxed. We bring you back. We do the procedure. And since you are awake, if your husband, your friend, whoever brings you wants to come back and visit with you while we're doing it, they can. If you would like to bring some music to listen to, your own earbuds or headphones, you can bring those. The procedure itself lasts, like I said, about 30 minutes, and then after the procedure's over with, you get dressed, you go home.
Wow.
It almost sounds too good to be true,
It does.
but in this case, it really is.
Right.
I've done about 1,600 of these procedures, and the majority of my patients will do super.
Good.
So today we're going to do an exam and do a bimanual examination. You're up to date on your pap smear, so we don't need to do that. We'll do an endometrial aspiration. We put a small little straw up inside the uterus, get just a little bit of tissue. Most women say if they feel it at all, it feels like a mild menstrual cramp. And then we also need to do a sonogram, and we can do that today also. It'll be a vaginal probe sonogram. It's closer to the anatomy, therefore I think it's more accurate. And then at the end, we'll also get some blood work to check your thyroid gland, make sure that's not causing it.
Okay.
Again, most of these things should be normal, and if they are, then you will be a candidate for the HER option procedure, and we can schedule that at any time.
Okay, good.
Once we get all the results back, we'll start you on some prometrium. It's a progesterone agent that you'll take every night before you go to bed.
Okay.
You'll start taking that the second night of your cycle. It's going to accomplish two things. One, it'll shorten that cycle, but two, it'll also keep your lining thin so that we can do the procedure at any time during the month.
Okay.
Usually the best time to do this procedure is the week after your cycle because that's when the lining is the thinnest.
Right.
And we want your lining thin because that way the freezing will affect the basalis layer. That's the layer that regenerates itself every month.
Okay.
And by damaging that, hopefully the endometrium will not grow back after that's damaged.
Right, okay.
But it will not have any long-term effects on you.
Right.
So we give you the Prometrium. You take that every night until we do your procedure. And then, again, we'll call you. We'll get it all set up, and you schedule it at your convenience.
Okay.
Today, Cindy's having her option procedure done. We've done the sonogram, we've done the endometrial aspiration, and we've done the blood work, and all of her diagnostic studies have come back normal. So there's really no other problems for Cindy to be taken care of before she has her option procedure. Cindy and I have talked about it. She's very comfortable with the procedure. We've talked about all the risks and benefits and alternatives, and at the end of the discussion, she decided she's ready to go. So we're back today to do her procedure. So Cindy, I'm going to clean your cervix real quick, put the speculum in.
Okay.
And just put in a normal speculum, and then we're going to grasp it with a tenaculum to hold it steady. Now I'm cleaning the cervix with a little bit of betadine. Get nice and clean. Okay. Now Cindy has already had 2 kids, and so there's really no need to do a paracervical block. Sometimes when you have patients who haven't had any vaginal deliveries, whether it be C-sections or never had any kids, sometimes they do require a paracervical block. But in Cindy's case, we're not going to be using the paracervical block today. All right, so I'm going to go ahead and I'm going to insert the probe. Okay, Cindy, you're going to feel a little bit of cramping as it goes in.
Okay.
All right. There. All right, Christy, that's good. Good. Okay, it's coming in, Cindy. And it should just, I tap it up against the top of the uterus. You feel that?
Yes.
Okay, are you having much cramping right now?
No, not much.
Transverse, good. All right, now we can see that we have not perforated either the fundus or the sides of the uterus, and we're ready to get started.
Okay.
So I'm going to push the minus button on the probe, and now the freezing begins. I have to hold the probe in place for about 2 minutes. Once it's in place, then it's frozen there, and you don't have to worry about it moving any. But for the first 2 minutes, I usually hold it in place to make sure that it doesn't shift position. We're starting to see the freezing take effect, and you'll see a thin line forming above the probe tip, and as it does, it'll get further and further out from the probe tip, and it will develop an acoustic shadow beneath it where the sound waves of the sonogram are bouncing off of the leading edge of the ice ball. Now when I say ice ball, we're not expanding the cavity of the uterus. That's one of the beauties. This procedure doesn't distend the cavity. When some of the other thermal procedures, when they distend the cavity with the balloon or with the hot water, that can cause cramping, it causes pain. This is simply freezing the tissue around the probe, and the freezing will go out into the tissue without expanding the cavity. That's why one of the many reasons this procedure doesn't hurt. You're starting to see the leading edge of the ice ball form around the probe tip, and it's looking perfectly normal. We're advancing into the myometrium now as the freezing occurs. How are you feeling, Cindy? You having much cramping?
No, it's good.
Feels like, what, mild menstrual cramps maybe?
Yes.
Okay, good, good. Now this is usually about as much as discomfort as the patient has. I typically tell patients that imagine if you put an ice pack on your knee or your elbow, how it tingles for a second and then goes numb. Same thing here. We're freezing the pain receptors also, and so after a few minutes there's no perception of pain. There can be a perception of fullness, and then when you move the probe tip around, getting it into a different position, they can feel that, but there shouldn't be any feelings of pain. We're getting a real good picture now of the acoustic shadow forming around the probe tip as we freeze this side of the uterus. And I am on the right side of her uterus right now. We're freezing that. As soon as we finish, we'll go to the left side. Cindy's got a fairly small uterus. It's sounded to about 8 centimeters. So we're going to be doing a 7-minute freeze in the right cornu and a 7-minute freeze in the left cornu. Once we finish that freeze, we'll be done. Real nice shot of how the acoustic shadow now is forming behind the probe tip. So, this is about as exciting as these procedures get. And this is about the same level of discomfort that most of the patients feel while they're having the procedure done. I tell doctors when I'm teaching them, if they have an exciting her option procedure, then something's gone wrong, because it should be a very calm, very relaxing experience for the patient. We usually will have the patient bring some headphones or earbuds and their own music to listen to. They can also have their support person come in with them and visit with them. We didn't do that today simply because we're recording this, and Cindy's going to be giving some responses to certain questions. But otherwise, they're awake, they're talking, and it's a very comfortable, easy procedure for the patient to have done. How's the cramping now, Cindy?
It's fine.
Really?
Yes.
Still
very
about
light.
a mild
Yes.
menstrual cramp?
Yes.
Super, super. Well, it definitely is going to be a lot easier than if you had a thermal ablation.
Right.
Here you can see on the sonogram again a great picture of the cryozone, the probe tip in the center with the acoustic shadow around it and behind it. We're just about done with freezing on the right side, and we're going to go to the left side here in just a few minutes. You can also see the other anatomical structures. Cindy did a great job of filling her bladder up before the procedure, and that's definitely something that's important to have your patients do. It's very difficult to see what you need to see if they have an empty or a slightly full bladder. We tell them, our patients, we want them to have a comfortably full bladder when we start the procedure. Guessing probably 200 to 300 cc's of urine in their bladder. So they usually start drinking a lot of water when they get to my office about 30 to 45 minutes before the procedure. And by the time we get them back, the bladder is nice and full. It gives us a very good picture of all the anatomy that we need to see during the procedure. Again, beautiful picture of the cryozone with the probe tip there in the center. And we've still got we've been almost 7 minutes now, and we're not even close to the uterine serosa. So unless you've got a really small uterus of someone who's never had a baby or some other kind of problems, it's very difficult for you to freeze all the way out to the serosa unless you just really mean to. Cindy's got plenty of myometrium left, and no danger of freezing to the serosa or into the bladder. All right, so just about finished, Cindy, and with this side.
Okay.
And then usually it takes about a minute 25 to a minute 30 seconds for it to thaw out. Once it's thawed out, we'll move over to her left cornu. And during this process, I always make sure the patients understand they will feel movement, they may feel a little pressure, and maybe some mild cramping. They really shouldn't feel any pain. We usually will move the probe tip over, not taking it out of the uterus completely, but just pulling down to the lower segment and then redirecting it up into the contralateral cornu. During that process, you may feel some resistance when you push the probe in, and that's just hitting that frozen tissue. There's a port on the bottom of the probe tip where you can inject some warm sterile saline, and that will, along with the warm tip of the probe, allow you to get past that frozen tissue and then up into the contralateral cornu. Sometimes you don't need it, sometimes it's very helpful to have it. So I always have it ready for all my patients in case I need it. Okay, Cindy, so we're just about done with the thawing out process, and we're now moving the probe to the left cornu. And you're going to feel some movement, you're going to feel some pressure, but you really shouldn't feel any pain.
Okay.
If you do, please be sure and let me know.
Okay.
All right, so we're just about through the thawing process. All right, now we switch to to the longitudinal view, and you're going to feel me moving the probe, and as I gently insert it, you can see on the sonogram screen the freeze zone, and the probe will be coming in. We'll have to go around that zone into the left side. Okay, as the probe very gently. And I'm meeting a little bit of resistance, so I'm injecting some warm saline to help thaw out that previous freeze zone so that I can get the probe tip past it. But I'm meeting the resistance, but just a little counter traction, and it's just going to ease right on by. There we go. I just passed the frozen tissue. Now we're going up and just advancing it. And the markings on the side of the probe tell me that I'm about 8 centimeters in, which is exactly what she sounded to when we initially did her endometrial aspiration, so we know that we haven't gone too deep. Okay, and I'm just trying to get this in the right position. There we go. Nope, no, we'll move it back just a little bit and try again. Didn't like how that looked on the sonogram. Wasn't quite all the way up to the cornu. Just nice, gentle counter pressure. It accidentally gone into the previous freeze zone, and you can see the temperatures drop on the console, and if they precipitously drop, you know you've entered the previous freeze zone. You want to pull it back so you can get to the other side. So that's what I'm trying to do now. And you can see how having a full bladder makes this much easier to do because you can see so much more of the anatomy with this full bladder. Okay. Okay, so there we are, and we're all the way. Now we're going transverse. You can see the previous freeze zone, and the bright spot up at about 1 to 2 o'clock is the probe tip, and it's on the very edge of the outside edge of the previous freeze zone, and that's where you want to be. That way you know we're freezing some more tissue, not just refreezing the previous tissue that's already been frozen. All right, so I'm going to turn the console on now, and we'll start the second freeze. And usually I will do 2 7-minute freezes, one on each side. It's easier if you're first starting this to use maybe a 4 or 5-minute freeze on the first side so that the freeze zone doesn't get so big that you have difficulty getting up into the contralateral connu. As you get more proficient in it, more comfortable with it, then you can start extending your freeze times to 7 and 7 for each cornu. In larger uteruses, if you have, it sounds more than 9 centimeters, then I will usually do a mid-fundal freeze for 4 minutes, then do the cornus, and then pull it back and do a lower segment freeze. But in Cindy's case, hers uterus cavity only sounded to 8 centimeters, and so we're only going to do the 2 cornus because there's really not enough tissue for you to do a lower segment freeze with such a short cavity. But as you can see on the sonogram, the probe tip is in. We're readjusting the transducer to get a little bit better picture, but the previous freeze zone is there, and now we're doing the left cornu. How's the discomfort?
It's fine.
How does it compare to the other side when we first started?
Not as bad.
It's not as bad on the second.
No.
And that's usually what the patients will say is a lot of the nerve receptors have already been frozen, so they really don't have a perception of pain on the second side. Again, very easy, very tolerable for the patient. And again, this is a very typical procedure for us. We have very good results from the patients. They do not have any significant discomfort, and therefore they're more inclined to come to refer their own family members, their friends. They tell the referring physicians, and they will send more patients also. So it's a good procedure for the patient in that it's a good experience, plus it gives them the results that they are really looking for, that being a normalization of the cycles. As you can see, the freeze zones now have come together, and instead of having 2 separate freeze zones, they have formed one large freeze zone, and we are still at least a good centimeter and a half away from the serosa of the uterus and the bladder. So again, there's no danger for having any type of damage done by extending the freeze time. Now, usually after the freezing is done, the tissue is frozen. The uterus perceives that as almost like a blood clot, and so it tries to squeeze that frozen tissue out, thinking it is a blood clot. Well, it can't do that because it's frozen tissue. What it does do, though, like any muscle that's exercising, it increases the circulation around that frozen tissue, which thaws it out. And I usually tell my patients about halfway home, they're going to start feeling some midline cramping. It's normal, and it's only going to last for about 45 minutes to an hour. Once that hour mark has been reached, usually that frozen tissue is thawed out and the significant cramping will stop. Sometimes patients will have physicians not tell them this, and they get a little concerned thinking, I feel like I'm having labor pains. So I always make sure to stress both to the patient before the procedure ever starts and to whoever brought them to the procedure. It's normal to have this significant cramping for about 45 minutes to an hour after the procedure. That way, they know to expect it when they get home. If they want to take some pain medication that you prescribe them, maybe get a heating pad and put it on their tummy, lay down and take a little short nap. By the time they wake up, the cramping should subside. And then after that, I usually start them about 3 to 4 hours after the procedure by taking ibuprofen. And they take that throughout the weekend, about every 8 hours, and that also helps minimize the cramping that they'll experience from the procedure. So we've just about gone 7 minutes on Cindy's left cornu. As you can see, the 2 distinct cryozones are now combined to form one cryozone, completely involving the endometrial cavity. This particular side's a little bit closer to the serosa, and it's almost to 7 minutes now, so we're going to go ahead and stop it. And as we stop it, the advancement of the freezing zone will stop, and the probe tip will start thawing out, so that in about a minute and a half or so, we'll be able to remove the probe tip. How's the cramping, Cindy?
Not bad.
Not bad at all?
No.
Have you noticed any difference between the left side and the right side, this being the left side?
Yes, not near as bad as the
Okay.
first.
But the first side, on a scale of 1 to 10, what would you think that'd be?
3.
Okay. And then on this left side now?
Maybe a 1.
Okay, super, super. Again, that's a normal reaction to the procedure for our patients. So now we're doing, a shot of the uterus, and you can see one complete uniform cryozone involving the entire cavity. And this is a longitudinal view now. And now it's a transverse. There we go. There's the longitudinal. There you go, right there. Perfect. All right, so I'll go ahead and I'll take the probe tip out now. So it's in there. We'll be pulling out. You're going to feel some pressure. There we go. And take that speculum out. Speculum's out. And I'll talk to you after we get through getting dressed. But the procedure went great.
Okay, good. Thank you.
Well, thank you. All right, Cindy, so how have you been doing since you've had your procedure?
I've been feeling good.
Good. Did you have much discharge after the procedure?
No, it lasted about 3 days.
Really, 3 days?
Mm-hmm.
We typically see the discharge lasting 2 to 3 weeks, so yours was a
Wow.
lot shorter than it usually is.
That's good.
What about cramping? How was that weekend after the procedure?
No, I had a little nausea right after I left, but I laid down, and once I woke up, I was fine.
Wonderful. So Saturday morning you were able to get up and do whatever you wanted to do?
I sure did.
Wonderful. Have you had a period since we did your procedure?
Yes.
And tell me about that.
It lasted about 4 days and wasn't heavy at all. It, started off normal, and then it was light for 2 days, just barely. So.
Well, good. And did you have much cramping?
No.
Wonderful. And overall, how have you felt since you had the procedure done?
I felt real good.
Good.
Yes.
What was your perception of the procedure after it was done?
I'm very happy I had it done, and I would definitely recommend it.
Good. Have you and your husband been intimate since we did the procedure for you?
Yes.
Any problems with discharge, pain, anything
No,
like that?
not at all.
Wonderful. All right, so Cindy, we're going to have one more appointment in about a month. We'll
Okay.
see how this next cycle goes.
Okay.
Hopefully it will be even better than the first one. If you have any significant bleeding, cramping, any more discharge, be sure and call me.
Okay.
But as far as activity level, you're welcome to do any and everything that you want to do.
Okay.
And I'll see you back in about a month.
Okay.